Back to Chats with Dad, episode number 3.
Wow.
We're pretty consistent so far.
Welcome back.
All right, so today, as a follow up on our first 2 episodes, the first episode we covered a lot of nutrition. Second episode, we did a lot of discussion of big pharma and medications, but it was sort of more of an overview. And so today, what we wanted to do was do a little bit more of a deep dive into some of the pharmaceuticals, but also talk about overall taking responsibility for your health and what that looks like. And I think more of a practical perspective and basically things you can implement today in your life,
Right.
taking responsibility for your health. And a lot of times you can have so much information and I think feel overwhelmed. So with today's discussion, what we wanted to do is just break it down a little bit easier to digest, understand, and some bullet points for viewers, listeners to write down, reflect upon, and maybe talk about with your own coach, health professional, pharmacist, doctor, etc.
So, and it's important to say, I mean, we want to be good educators. So we want to educate you in a way that stimulates you to be a lifelong learner.
Yeah.
And some of the information we give may be different tomorrow. It changes over time. Our understanding grows and expands and changes over time, as yours should. But the most important thing is it's your responsibility. Your health is your responsibility.
Right.
And so it behooves you to get as much and as good of information as you can.
Right.
Okay.
And science is questioning the science, like you said last time.
Right.
And so I think there's a lot of times there's almost this notion of you can't question anything and question what we say.
Well, one adage for sure, if someone says to you, don't question the science, they're selling you something.
True.
It's a way to overcome objections, is to say, I've got the science.
Yeah.
So
very true.
Yeah.
Yeah, and that's not very humble.
Can we look back a few thousand years?
2,000 years? Sure.
Yeah. A lot of people have heard about the Hippocratic Oath for medicine. Hippocrates, he was an ancient Greek physician. He's considered the father of Western medicine. He said at one time, let food be thy medicine and medicine thy food. How far we've gotten away from that because we think we can do better than God. So man continually faults by believing that he can improve on what God's made. Sometimes it's for convenience, sometimes it's very helpful, but usually man is looking for a market that he can sell into. So we believe, and I think I can speak for both of us, that all improvements in your health start with lifestyle alterations and decisions that you make.
Right. Well, and quick fixes and extremes, I actually just talked about this today. I did a little live video just talking about the importance of sustainability and flexibility when it comes to a plan or it comes to let's say I just gave an example of a wedding prep that I took one of my clients through. And the reason it was so successful is because it was sustainable and it was about lifestyle. And it wasn't about, just giving her crazy amounts of cardio and eliminating all food, certain food groups. And I mean, I've had coaches in my past that have told me that I couldn't eat fruit, couldn't eat bread, basically any carb that wasn't a vegetable, or 3 ounces of a sweet potato. Sometimes he'd allow me that. Then it was bad. And that misses, it's that extreme. The reason that he was able to sell those programs is because he marketed a notion that he had a secret, basically, that you follow my diet plan, you'll be successful. And like you said, if someone is saying that they have some secret or some, don't question me, which that's very much what I fell into when I was younger, were following some of these plans that I couldn't ask questions. And why is that? Well, because of, I think a lot of times the root is pride and individuals who think that they know everything, but truly, when you look at the big picture, you're missing the forest among the trees. So sure, you might lose weight on this extreme diet, but it's not going to teach you lifestyle changes, habits. It's not going to actually enable you to live a successful, long term, healthy life,
Right.
or long term successful plan when it comes to fitness.
Right.
And that's when I struggled the most and was so up and down with my own nutrition and training, was when I was trying to do things extreme. And so we see all of these extremes in our society. How many people lose weight every year? Tons, millions of
Mm-hmm.
people. How many people keep it off? Very few.
Right.
So, like you said, it goes back to lifestyle, taking responsibility for your health, and really looking at what are the small changes that I can make today, tomorrow, for the rest of, for the rest of my life, that are actually going to be sustainable, but keep in mind the bigger picture of health, not just my body goals.
I made a small change that dramatically changed my life.
What's that?
Do you want to know about it? I
Maybe.
think you already do. But
Oh.
I had herniated a disc in my back about a decade ago and was having neuropathy and a lot of pain. And I just started doing 15 minutes of foundation training in the morning every
Which,
day.
explain what foundation training is, because people don't know.
Well, foundation training, gosh, I forget the guy's name. I want to give him credit.
Just Google foundation training.
Foundation training, it's by this doctor of um, chiropractic care that came up with this idea. But I spend 15 minutes a day, um, every day doing it. It's not much time. And it has to do with core strength, flexibility,
Mm-hmm.
abdominal strength, back strength. But it's dramatically changed my ability to do just about anything. I never have back pain anymore.
Hmm.
And it's just 15 minutes a day.
Hmm.
So it's really significantly changed my life.
Actually,
So
same. I guess I
yeah,
didn't even think about that until you mentioned it.
yeah.
So I've been incorporating. My brother had back surgery, and he's actually the one that told us about this foundation
Mm-hmm.
training. And I started to implement some foundation training probably about a year and a half ago. And do you ever hear me complain about my back much anymore?
Not much. Not ever, really.
Ooh.
Yeah.
So definitely, I send that to my
Mm,
clients sometimes.
yeah.
So yeah, small changes, and also another thing that goes along with that for me was not being afraid to change my training. I got so legalistic with I have to do certain compound lifts, I
Mm,
have to bench press, I have to squat, I have to do all these things. And I found that I'm much more successful in terms of being able to sustain training when I'm making those adjustments and accepting the fact that just given my proclivity to a lower back and hip issue, I don't barbell back squat anymore. I get so much more
mm-hmm.
benefit from doing a split squat. And so making those adaptations, doing variations, not being afraid to change things, I think is a really important part of long term success as well. And like we said, changing your perspective on things when applicable,
Right.
because there's new information coming out all of the time as well. And we can't get prideful in our own perspective.
Right. So let's just talk
Yeah.
about some of the things that
Yeah.
we've already talked
Yeah.
about. In terms of lifestyle alterations, the water you drink, the fluids you drink, very important.
Mm,
I mean, like chlorination kills your
mm,
microbiome. So when you drink city water that has chlorine in it, you're really hurting your gut health.
mm,
Food, obviously, whole natural food. My old adage that I learned from my parents was if God made it, eat it. If he didn't, not much. And so very rarely eat processed foods and
highly. And I think
highly
I think it's
processed.
important to make a distinction
Yeah.
too between processed and highly processed,
Mm-hmm.
because we could look at things in my pantry like flour. It's
It's
processed,
processed.
but it's not a highly, when we're talking about highly processed food, we're talking about the candy bars, we're talking about the fast food, we're talking about the, I don't know, multitude of things that you see just in the general American diet, candy, etc. Whereas, you bake a loaf of homemade sourdough bread, someone would say, oh, well, that is processed. And yes, that
Mm-hmm.
is true, but it's not highly processed with added sugars and preservatives and high fructose corn syrup and all of that stuff. So,
But it's kind of like my foundation training and yours that if you just do a little of this and stay consistent on it,
mm-hmm,
what you drink, what you eat will dramatically change your life
mm-hmm,
if
yeah,
you're really conscious of it.
right.
If you can't identify it on the package label, though, probably don't eat it, right?
Yeah, I mean, everything. I think it's important though to remember like moderation, though, like you said,
Mm,
because I've seen too with especially individuals in the fitness industry become so fearful of any sort of preservative that it like
hmm.
controls their life. So it's like we said, it's more about the lifestyle and then kind of the 80-90%, 90 to 10% rule where okay, something has a preservative in it or you can't pronounce it on the label. I don't think that's me, if it's 10% of your intake, it's not, you don't need to freak out about it.
Right, right.
So,
Well, here's an interesting little factoid. Um, Americans spend more on drugs than all other countries of the world combined, but we
ooh,
spend less on our food,
hmm,
which is interesting.
hmm,
Other developed countries, for instance, in Europe, spend much more on food,
hmm,
much less on drugs.
hmm.
So, um,
Interesting. And they're much healthier in general, a
yeah.
lot of these countries. Um, so,
So, we start looking at our health, and, we have certain markers that we look at. We have long held beliefs in the medical system that may or may not be right. Humans uh, vary so widely that it's awfully hard to have a specific number that indicates good health. One thing is for sure, though, humans were made to be outside,
mhm.
not inside. And we're in about 87, 90% of the time. If you live in the
Not
Midwest
me.
where we're at, a lot
I'm
of people
outside
are in
all the
there
time.
95% of the time.
Yeah,
Yeah, that's
yeah.
kind of your place, isn't it? Getting outside.
Well, I've noticed tremendous benefit
Hmm.
to my mental state, even just when it's freezing outside. We don't exactly live in, the wonderful Pacific coast or, somewhere where it's just, I
Oregon.
don't know,
Hmm.
California or something like that.
Hmm.
Or even like South, or a lot of times it's pretty miserable here. But even the difference in not only my energy, but also my mental perspective and just how my mental clarity and sharpness is dramatically improved, even if I have to suffer a little bit outside.
Hmm.
And I think in general, we just desire comfort and convenience and warmth. And really, in general, I think the majority of people could challenge themselves to get outside a little bit
Hmm.
more, even when it's not, 60 degrees and sunny or 70 degrees and sunny. And there is, I mean, this is scientifically proven, the benefits of sunlight exposure, especially first thing in the morning, when you can regulate your circadian rhythm. So, looking, not, you don't have to, don't stare directly in the sun, but
Hmm.
exposing your eyes to when it's sunny outside, 10 minutes, when it's cloudy, 30 minutes towards the first part of your day. I mean, it doesn't have to be immediately, but that is tremendously beneficial to your circadian rhythm, to your overall um, sleep quality. It's
Increases serotonin levels.
right. So, and then also exposure to the light when the sun is setting at night has been shown to improve sleep quality. So we're very much an indoor society and in an artificial light society as well. And so that the blue light, the artificial light that comes from our phones, that comes from TVs, comes from our screens, does contribute to, I think, a sleep imbalance that we see with a lot of people as well. So I
Hmm.
think just taking a couple of steps to regulate your circadian rhythm can be tremendously beneficial.
So
So
there's
yeah,
besides just being beautiful,
yeah,
sunrises and sunsets are good things
for your health. And
to
then
watch.
and then
Yeah.
also exposure to sunlight for your vitamin D levels as well,
Right.
which most people have to supplement with.
Right.
But I mean, there's just so much. Not only, okay, we can talk about circadian rhythm, we can talk about your sleep, but it just makes you a happier person in general in
Hmm.
terms of spending time outside. And I think that that really is a reflection of the fact that God created us not to just be inside and staring at a screen for
So before we get to the drugs, which everybody's waiting for here,
oh,
what about exercise? I mean, there's this balance, and this question of balance between aerobic and um, uh, weight training, resistance training.
mhm.
What's your opinion on it?
My opinion is that the majority of individuals tend to gravitate too much towards cardiovascular exercise when they're looking to build a healthy lifestyle, and they tend to negate resistance training.
Hmm.
And I think we are under muscled as a general population. We are not strategically adding in resistance training as optimally as we could. And I mean, I think obviously I've worked in bodybuilding and powerlifting, and those communities are hyper obsessed with the resistance training component, but more of like a general in our society, it's very rare for me to meet a random person at church, at wherever I may be, that is dedicated to a consistent resistance training program.
Yeah.
And the majority of questions that I receive from lifestyle individuals are, will weight training make me bulky? And the answer is no, unless you are eating excessive amounts of calories. And if you're a woman, if you're on performance enhancing drugs, which I do not recommend for anyone. So, in general, I would say for the majority of individuals, even if it's 2 days per week, a two full body training programs per week, or an upper day and a lower day, getting in the gym, even if it's 1 day per week to start, some sort of resistance training program is very important, not only for muscularity, but also for your bone density and strength. And as you get older, it's important to be strong in order to avoid, I think, a lot of the pitfalls that many elderly individuals fall into from a lack of strength or coordination.
I was going to say, in the pharmacy, I saw hundreds and thousands of patients come in with pain issues,
Mm-hmm.
inflammation in their shoulders, in their neck, um, and in their back. That was due to a lack of muscle structure
Right.
and foundation strength
Mm-hmm.
more than anything.
Right.
And so, but they were taking medications
Mm-hmm.
to treat inflammation and pain, which further causes risk in their cardiovascular system and a lot of other ways, kidneys and their liver. So, the best way is lifestyle.
Absolutely.
And just look around at older men in America,
Mm-hmm.
flabby necks, little shoulders. They might have strong calves because they walk a lot, but they have no back and
Mm-hmm.
shoulders, really. So
Yeah.
it's the classic American older male.
Yeah. And the
Yeah.
biggest bang for your buck is going to be compound lifts. So, compound lifts, I think a lot of times there was a misconception because of the prevalence of powerlifting that it has to be like a squat, bench, or deadlift. And a
Mm-hmm.
compound lift just means using multiple muscle groups. So, a
Mm-hmm.
shoulder press, sure, a chest press, a leg press, a lunge, a squat. But it doesn't have to be a barbell back squat. It could be a
Mm-hmm.
multitude of variations. And it's so important for strength, for muscularity.
Pull-ups, right?
Yeah, but women in general can't do those.
Uh,
So, and I mean, I don't even do those because of my
it's
elbows.
for us guys.
I used to be able to do them, but then I beat myself up powerlifting and my elbows can no longer take pull
Mm,
ups. So, I usually do variations of pull downs, and I don't think my back definition has suffered for
right.
that. um, but it really is a combination for sure of resistance training and cardiovascular exercise, but in general, making sure that resistance training is a focus, I think is very important.
Mm-hmm.
So
Ready to talk about drugs?
yeah. So why, despite the fact that we have so much science, so many drugs, but we're very unhealthy, what's going on in our
Mm.
country?
Well, we live in a drug culture. You don't need statistics and facts to see the declining health of our country. Um, our life expectancy in America is the 47th in the world
Ooh,
of developed countries,
wow.
So we're really not doing that well. Even
Mm-hmm.
our infant survival rate is worse. It's well down the list. I don't know the exact number. Um, and here's a good question for you. I mean, do you want to live longer but sicker?
Mm-hmm.
Some of the drugs and the innovations we've gotten in medicine allow you to live longer, have saved some lives, but that doesn't mean you live a quality life. Um, patients that would come in and see me and ask me, what do I need to do, for this condition that I have, and often there was a 30-pound belly sitting on my counter in front of me, and I was like, take care of that. That's step one. Um, so And again, as I said earlier, when pharma and science in general says trust the science, they're selling you something. So there's no doubt that we save lives. There's no doubt that we have the ability to treat conditions that we never had the ability to treat. But something's wrong when you look at the overall health of our society. 66% of our population's on prescription medications in America. You go to Europe, it's 40 to 55%, depending on the country. 42% of our country is obese.
Mm-hmm.
80% are overweight.
Mm.
And so, you look at that BMI, which BMI is not that reliable for somebody that's really has good muscle
Right.
structure and things, but for most of the country, it does apply. Um, and then we're seeing something new. It used to be an endocrinologist wouldn't see a type 2 diabetic child, adolescent,
Mm.
ever in their
Mm.
practice. And now it's becoming common,
Right.
as is hyperlipidemia, high cholesterol in children.
Mm.
Um, so I think when you look at um, taking medications, obviously our first advice would always be, is there something in lifestyle that I
Right.
can do?
Mm-hmm.
Um, but there's not a quick fix for everything in our life.
No.
Um, so the average person that's over 60 in this country is now taking 6 medications per month. That's unbelievable.
Yeah.
And they say that when you hit 6 medications, there's 100% chance that there's an interaction between one
Mm.
of those drugs or two of those drugs.
Yeah.
That's a significant problem. Um, we have a healthcare system where prescribers unknowingly, sometimes knowingly, but usually unknowingly, push the pharmaceutical industry's agenda
Mm.
of selling more drugs. How does that happen? We talked about that in the previous episode. They fund medical school, they
Mm.
fund pharmacy school. I'm not sure the degree of funding in nursing school, but I'm sure it's growing because now you have nurse practitioners that
Mm-hmm.
are prescribing, and so it behooves the pharma industry to get in the nursing schools now too.
Right.
Um, Unfortunately, a lot of people think, well, I just don't have the willpower to make the lifestyle changes I need to make. So a medication is a option.
Mm-hmm.
It's not the best option. Um, Many of the common drugs that we take in America have some huge consequences um, that you should really think twice about them. Now, again, I want to state, I don't want you to change anything without discussing it with your physician. If your physician won't discuss it with you, you probably should get another physician. But you should discuss it openly with them and they should make the changes. The first category I want to talk about is cholesterol
Mm.
medications, statins. For a while, there were people that were advocating statins for just about everybody. I think it's almost like it got to the point where it was almost like fluoride. They'd put it in our water had we let them do it. And many doctors think of it as a preventative strategy without really thinking through the consequences. A lot of people have seen ads on TV for coenzyme Q10, and they always say if you're taking statins or medications for hyperlipidemia, you should take this coenzyme Q10. Well, coenzyme Q10 is essential for your mitochondria to produce ATP,
Mm-hmm.
and that's responsible for the energy in your body and your muscles. Um, Statins can reduce that.
Mm.
And there's another thing. I mean, there's statins. There is a natural way to treat cholesterol, and it's niacin. Now, the effective dose can vary widely. Um, there's a pharmaceutical version of niacin that people take 1,000, 2,000 milligrams. It's not well accepted, and the reason is that it causes flushing. It causes your
Oh yeah.
blood vessels to dilate
Mm-hmm.
and drives patients crazy, but it's extremely effective at lowering total cholesterol, raising your HDL, lowering triglycerides. But the thing is, in my experience, people vary widely. Some people will literally respond to a couple hundred milligrams a day,
Mm.
and it can significantly improve their numbers on their phospholipids in their body.
Mm-hmm.
Okay, well then moving to a different one. Bisphosphonates. Do you have
Wanted
a
to mention,
question?
well, I
Yeah.
wanted to mention something. So I've seen some of my clients who are in their 20s be prescribed statins.
Mm.
And thankfully, I have my dad. And so I was
Yeah.
able to tell them that, well, would you like my dad to look at your numbers and give you like a consultation or whatever? And I remember specifically there was one client who said, yes, please, and then you were able to give her recommendations and she didn't end up taking it. But
Mm-hmm.
you looked at her HDL and LDL, and I think, would you say that there's a tendency for doctors to overreact to one number as opposed to actually looking at the ratio and kind of looking at the
Yeah.
overall perspective?
Yeah.
Yeah. And
Yeah.
that's,
So they look at total cholesterol, and
mm-hmm,
my total cholesterol typically is 205. Well, being over 200 is a bad thing,
mm.
but I have a good HDL and very low triglycerides, very low
I
blood
think mine
sugar.
was high last time I got tested, right?
I think it was. Yeah. Yeah.
Yeah.
Yeah. It might have
So
been
it
about like
flagged as
mine.
being high, but then
Yeah.
you look at
Yeah.
just
You look
break,
at the
yeah,
whole picture
right,
and the overall health and the
right.
family history. I mean, there's a lot of things that go into this.
Mm.
Um, they also now are tying statins also to dementia.
Ooh,
And
wow.
whereas they, at one point early on, were saying that statins could prevent dementia, now it's being tied
Oh,
to
trust the science.
higher incidence of dementia. Another thing we worry about in a health condition in America is osteoporosis,
Right.
osteopenia. There's this class of drugs called bisphosphonates. Some examples are Reclast, Boniva, Fosamax. Um, and what these do is they shut down a cell in your body called an osteoclast.
Mm.
So in your bones, you have an osteoclast and an osteoblast. Osteoclasts are responsible to break down the old bone, and the osteoblasts build up new bone. And so there's this constant turnover of
Mm-hmm.
bone. You think about, well, why would that be necessary? Well, it's renewing it.
Mm.
So if you stop the osteoclast from breaking down the old bone and you're just building on top of that, the bone looks more dense and thicker,
Mm.
but it's on sicker bone.
Mm.
And so we've had some problems where if people go in for implants, dental implants, they find that sometimes the jaw has necrosis and actually can't accept implants
Oh,
because the bone is actually
wow.
more brittle.
Wow.
And that if you are particularly an Asian woman who is small boned, of course that could happen in any, but that's a classic Asian woman, small bone, smaller in stature. The density of the bone to the doctor, as compared to the standard, looks
Mm.
smaller. So what does he recommend? Fosamax.
Mm.
And I tell you what, why not exercise?
Mm.
Especially if you haven't had any consequences of osteoporosis with broken bones
Mm-hmm.
and degeneration of your spine. Um, Certainly exercise
Yeah.
and something that can vibrate your bones. So it
Mm.
has to be vigorous walking,
Mm.
weight training,
Mm.
maybe jumping rope.
Yeah.
Um,
Plyometrics.
yeah. So much better choice than the
Mm.
bisphosphonates.
Yeah.
Bisphosphonates can also cause tremendous acid reflux
Oh.
and burning and even scarring
Oh.
of the esophagus.
Mm.
Um, the next class, antibiotics. Now, my reason for limiting antibiotics is different than what most people will hear.
Mm.
They talk about overuse of antibiotics and bacterial resistance, and we're going to come up with this super bug that's going to overwhelm the
Mm.
system because we overuse antibiotics. Quite frankly, I don't believe in that theory, and it's a theory. It's not a scientific fact. Um, I believe that in a hospital is where you usually see the superbugs. Um, Antibiotics kill all the competition, and then you have the overgrowth of a resistant
Mm.
bacteria. And so I think it's much more likely that you have 6 strains of streptococcus, and that when you kill 5 of them, the one that is resistant to the antibiotic overgrows and causes problems.
Mm.
I don't think you're going to see that in the community at large, although we see necrotizing streptococcus and things like that, very serious infections that are tough to treat, but we're not getting a growth of superbugs throughout our society. But the overuse of antibiotics kills your gut microbiome.
Mm-hmm.
And so you take these antibiotics, and throughout your stomach and your intestinal tract, it's full of friendly bacteria that is essential for the functioning of those organs, and also for the production of serotonin even. Most
Right.
of your serotonin receptors are in your gut.
Right.
They're not healthy when the bacteria aren't healthy.
Right. Which goes into then also mental health and antidepressants and SSRIs. I think a lot of times we skip over the gut health
Mm-hmm.
component and we just go straight to prescribing antidepressants or SSRIs when we don't actually look at the entire totality of someone's diet, someone's lifestyle, their gut microbiome. Were they just on an antibiotic and now all of a sudden they're struggling with feelings of depression? Is it winter? Are they not exposed to sunlight, vitamin D levels, all of these things, which goes into exactly what you just said.
Yeah.
So, yeah.
Well, how about hypertension?
Mm.
Okay, so number one, I think it's really important to understand how you determine when a patient has hypertension. Because if you just have one or two readings in your doctor's office, and envision this. I mean, you walk into the doctor's office, a technician comes in and immediately takes your blood pressure.
Mm-hmm.
You're probably anxious about
Mm.
the appointment to
Yeah.
begin with. You just walked in,
Mm-hmm.
your blood pressure is going to be up.
Higher.
And then they wait 10 minutes and they take it again. And typically it goes down. But even those two readings are not really sufficient to diagnose hypertension. You think about how cortisol can affect your blood pressure. And so there's a lot of things that can affect our cortisol levels, stress being one. But if your cortisol levels are up, your blood pressure is up, but that doesn't mean that is occurring most of the time in your life. So the best thing to do is go to your doctor, and if he says we should consider blood pressure medicine because of this reading in the office, and say you're 140 over 90, which for a younger person would be high, um, you should measure your own blood pressure at varying times of the day over a month, and kind of get an average and see. And I mean, the bottom line is with high blood pressure, yes, over a long period of time, it's a risk for your kidneys, for your heart, if you consistently have high blood pressure. But typically, it's not an emergency. And then if you're older, if you're like me, 140 over 90, while not ideal, is not an emergency at all. People's blood pressures, when they get older, actually are often overtreated so that they have risk associated with dizziness and falling.
Oh, right.
So, what do you want to do? Take your own blood pressure, but also lose 10 to 20 pounds. Most people are 10 to 20 pounds overweight. When we say overweight, 20 pounds wouldn't be considered obese in a lot of people,
Right.
but it can have a profound effect on your blood pressure. And so, an adage they use that 5 to 10% body weight loss can have a profound effect on your blood pressure. And then you got to watch your sodium and your potassium balance. And so you want to be sure you're getting foods that are high in potassium. You can supplement it, but it's hard to get any kind of supplement with any significant amounts. Um, and then do watch your sodium intake. That can make a big difference too.
All right.
All right.
Moving on. Next one.
Depressed America.
Yeah.
Okay.
Yeah. Antidepressants and attention deficit. I think that these two we've seen a huge increase, especially in the past 20 years or so.
Yeah.
And so, what would your recommendation be before taking an antidepressant or SSRI?
Well, number one, I mean, our proclivity to go to antidepressants and drugs for attention deficit is because of our society's overall trust in the scientific community. And they think that depression is due to the chemicals in their brain, and that some people are just born that way. Their balance is off, and so they need a medication to correct it, increase serotonin or norepinephrine or dopamine.
Right.
So they play with these. I can tell you that it is totally experimental with every patient that comes in. And that's why typically a person that's put on an antidepressant is put on a second antidepressant or changed to another one multiple times during their experience of taking these medications. Most depression, though, is not the result of a primary imbalance of neurotransmitters. You have to address lifestyle.
Yeah.
And so many things affect how we feel mentally.
Sleep, sunlight exposure, vitamin D, magnesium, exercise. If you're not exercising, your nutrition, microbiome, your gut microbiome. I mean, yeah, and a lot of those things are not looked at. Interesting. I was just talking to someone recently who was actually asking kind of for my opinion on this situation, because her doctor gave her I think it was an anti-anxiety medication, and didn't ask questions about her lifestyle, her diet, none of that. And she said that she was experiencing some of these side effects, negative side effects, such as feeling numb, feeling off. Her sleep wasn't improving. And then her doctor actually bumped up her dosage. And we actually were able to have a conversation, thank God. And I just talked about some of the things that we've talked about, and, just the factors that you should consider before taking an SSRI for the majority of people, obviously. And it was interesting because the conversation that she had, she said, I think I need to get off. So long story short, she got off, and I saw her, and she said, I feel like myself. And she started to implement some just different recommendations that I had for supplementation, like ashwagandha, herbal supplementation, magnesium, a couple of other things. She said, I feel so much better being off of the medication and then implementing some of these other things. And she started exercising, and she started to make these changes. And I just thought, how many individuals, and that's obviously one example, but I can think of many that have come to me, some of my clients, and have had these discussions with me. And it really is pretty shocking how none of those things are discussed with many doctors.
Well, they don't have time.
Yeah.
They don't have the knowledge. I mean, one of the things I've done for 40 years is work with alcoholics and drug addicts. And so I was a certified chemical dependency counselor for a while. I'm not certified anymore, but I continue to work with them. And probably a couple of the most common issues they have are life expectations, what they expect from life for whatever reason, projection, both to the past for regrets, to the future with fear and anxiety. And they're very closed. They don't talk to people. And so they hide with their drugs and their alcohol. Once they learn that they need cognitive therapy, they need to talk about it, probably with a professional counselor, maybe just with a group of people with similar problem. But they need to talk about it and air things out and get it out in the open, and it can dramatically change their mental state. And so I've seen people have remarkable transformations. They become new creations, new creatures. And a big part of that too is spiritual. And so spiritual is at least as effective as medications, and probably in my case, and I consider it more effective. It's certainly the first choice, cognitive therapy and some kind of spiritual program. To treat.
And we believe that we're spiritual beings with a physical body, not physical beings. So if you're not nourishing your soul, then I mean, personally, I've never been happy when I've neglected that part of my life. So there's something to consider too. Like if you're not a Christian or a religious person and you're experiencing some difficulties in your mental health, like considering we've tried everything.
Right.
So what do you got to lose with
Yeah. Uh,
with surrendering that too? And I think a lot of times with individuals, would you say sometimes it comes down to control too, like being surrendered to a higher power a lot of times
well,
is yeah,
that's the core issue.
yeah.
Is I mean, number one, we got to stop playing God. We realize that there is a God, that He could help us, and then we turn our lives and our wills over the care of God. And Jesus Christ promises that we'll become new creations in Christ. And I've seen it too many times to doubt that, and it's true for me. So,
Yes.
yeah. So,
Me
an
as well.
attention deficit. We went over some of the statistics, the number of
Yeah.
kids that I would have been drugged. I was so disruptive, and I had a hard time sitting still. My learning style did not fit the school system, um, but I learned. You just had to be patient, and thank God I didn't. Take those medications. I think one of the saddest things you see in children that are given medications for attention deficit is I think you lose a creativity in them,
Mm,
an essence that just of spontaneity even that is just sad to see diminished.
yeah.
Bottom line is they're prescribed to make other people's lives easier, not the
Mm,
patient's.
mm,
And another thing, some of us are fast processors, some of us are slow processors. Some of us like to take information in and mull it over and don't want to respond right away. Some of us, as soon as we get stimulus of an idea, it takes us to 10 other ideas. You know a guy like that. And so
I think I'm married to him.
yeah, but that's great. But you know something? It's very inconvenient for a slow processor, and so
Uh,
both have to kind of learn to live and work together that way.
mhm.
And
Yeah.
so,
Yeah.
yeah.
I did very well at test taking, but I struggle with creativity sometimes. So
Mm, yep.
some of us can pay attention and aren't given drugs, but then we have other struggles. So yeah,
Yeah.
I think I've seen too, and a lot of other people who maybe have that tendency for being diagnosed with ADD or ADHD. Those are the types of people that I need to actually work with because they are the strength that I don't have.
Hmm.
So it's not. I don't see it as a weakness at all. Obviously, some people if it's a real struggle in their own lives, then maybe they need to take steps to deal with that, obviously. But I
Hmm.
think it should be looked at as being a strength that just needs to be managed.
Right. Right. Exactly.
So, well, um,
Let's talk about your favorite subject, protein pump inhibitors,
and
right?
acids,
And acids. So, um, America is the most alkal, alk, what,
alkalized,
al- alkalized
alkalized.
country in the world. But anyways, protein pump inhibitors like omeprazole, which was Prilosec, and then esomeprazole, which was the new purple pill,
Mm,
Nexium. Um, they raise our pH in our stomach. And
mm,
so they are reducing the acid. The idea is that then it won't splash out into your esophagus and burn it. But you got to ask the question, why is the sphincter even open?
yeah,
And but there's some real consequences to these medications. Lately, you've been hearing a lot of talk about how it's tied to dementia.
right.
Now, why would that be? We're not 100% sure, but think about all the things that it affects. When you make the gut more basic, you don't absorb your calcium, magnesium, iron, zinc, potassium as well. You don't absorb your B12. Um, you don't manage the gut biome as well. It's
Hmm.
not as healthy in an
Yeah.
alkaline environment. But if you take it more than 4 years, you have a 33% increased risk of dementia. That's huge. That's huge.
Hmm.
So most people's GERD can be linked to the foods they eat.
Hmm.
And one of my favorite solutions for GERD is apple cider vinegar. You think vinegar. That's acid.
Right.
And but it has a negative feedback. The studies show that when you take acid into your stomach, um, apple cider, that it actually causes the sphincter to contract.
Mm.
And
And I've found that to be true for myself.
yeah,
I have chronic heartburn and have for years. And unfortunately, I, for a while, took Nexium, I think it was,
Nexium.
and it made it worse, 10 times worse.
Mm,
And so I would not recommend it because I was just desperate at one point and just decided to take it, and I didn't consult with you.
right.
And I don't know what I was
I mean, how
thinking.
bad could it be? It's over the counter, right?
Right, right.
Right.
Oh, horrible, horrible. I've never had such bad heartburn
Mm.
after I stopped taking it. And so I felt like I was just, I had to take it. But
It's
then
related to food too, right?
my,
Types of
my
food.
heartburn,
Yeah,
yeah,
yeah.
absolutely. And what I noticed it was tied to was timing of food as well, and eating too late or laying
Mm.
down on with food in my stomach,
Mm-hmm.
um, and stress. I didn't get heartburn until I started working a corporate job. So
Mm.
stress, anxiety, but also to the apple cider. It truly does. If I'm having a flare up and I take a swig of apple cider, majority of times it will go away. My
Mm.
flare up.
Right.
So, and then, yeah, it's one of those things that is so painful. Then you want that quick fix, but like I found, I took it for a while, and then even after taking it, my heartburn was 10 times worse. So, do not recommend.
Yeah. And it's not apple cider vinegar capsules.
No.
It's
Yeah.
the liquid.
Yeah.
What about NSAIDs? You know, America takes more NSAIDs than anywhere
So,
else in
what
the
would that be
world,
defined
too.
as? Because some people
That
probably
would
don't
be
know.
aspirin, ibuprofen, all the anti-inflammatory
Mm,
medications that we take,
right.
Advil. Um, Most people think, I mean, again, they're over the counter, and most people believe that stomach issues are the biggest issue with NSAIDs, and actually, that's not true.
Hmm.
I mean, that's a big problem. It's part of the problem, but it's not the most dangerous. NSAIDs can cause hypertension. They can cause kidney damage. They can increase your risk of heart attacks and strokes.
Hmm.
So several NSAIDs have been pulled off the market because of Vioxx was one that was a pretty popular and highly advertised medication for a while, and Vioxx was pulled off because of all the heart issues that it was causing.
Hmm.
Um, they should be taken with care,
Mm-hmm.
and we shouldn't think that every time we have a pain we should take an NSAID.
Yeah. Yeah. And
Um,
also, recently I was talking to someone who's from church who was having heartburn issues, and it was linked directly to taking ibuprofen. He stopped taking ibuprofen, and I think he was just taking it too much,
yeah,
and his heartburn went away. And he was
yeah.
like, "What?" Because he was dealing with it for a long time too, the heartburn.
Well, if you take like ibuprofen for a long period of time, um, it can actually cause a thickening and hardening of the renal arteries. And so
Ugh,
then that leads to permanent hypertension.
ugh, gosh.
That reminds me of something else. You know, we think about treating high blood pressure. A common medication we use is ACE inhibitors, so
Mm,
like lisinopril and Prinabil. These medications work on the renin system in the kidneys, and they help more blood get through the kidneys. But the long-term consequences of taking ACE inhibitors is actually a thickening of the lumen of the blood vessels in the kidney, and it eventually leads to a narrowing of the kidneys and an increased blood pressure.
oh
So they have
gosh.
to increase the dose or go to
Mm,
another medication. So again, a good reason to lose the 10% body weight
mm,
and try and treat your hypertension another
mm.
way. So even what we consider a pretty safe medication long term is not safe.
Yeah.
Okay, and
All
then
right.
last,
Last
weight
one.
loss. Yeah, Ozempic,
Woo!
semaglutide. They call these drugs GLP-1 medications.
What are they made for?
They're originally made for diabetics, and the real story behind it is that the representatives were talking about it in the doctor's offices that how great they are for weight loss,
Hmm.
and nurses And physicians started using the medications themselves for weight loss, not for diabetes.
Hmm.
And that's really how it caught fire. And you can lose a significant amount of weight, although I would say that at least a third of the patients that start one of these medications stops it because of the side effects of
Hmm.
nausea. And it can be significant nausea.
And it can paralyze your stomach, right?
Yeah, your whole gastrointestinal
Yeah.
tract.
Because essentially, what does it do?
It is sending out a signal that tells your body that it is full. And
Mhm.
so the peristalsis and movement of the gastrointestinal tract stops, slows down.
Makes,
And so you're
mm,
not hungry.
right.
Um, but also long term, it can lead to pancreatitis, paralyzed GI tract. And here's the bottom line is you got to take it for the rest of your life. If you're not making
Hmm.
lifestyle changes and you're
Right.
just using this drug, you're taking a dangerous drug for a lifetime. And the longer you take a medication, number one, usually the dose has to be increased. And two, higher dose, longer term, more side effects.
Right.
And they're linking it to not just pancreatitis, but pancreatic cancer.
Oh,
And so,
yeah.
big deal,
Yeah.
big deal.
Yeah. Huge deal. So, to wrap up, what would be your recommendations for? We'll
Yeah.
probably do the rest. We have other things we want to talk about, but we'll do another
Okay.
episode.
Yeah.
So, just as a summary.
So, as a summary, start with lifestyle.
Hmm.
It's your responsibility. It's nobody else's. Don't think you're going to find something in the healthcare system that's going to be a magic bullet for you. Find a physician and other healthcare professionals that'll listen to you,
Hmm.
talk to you, take you seriously.
Yeah.
When you have a side effect, will actually
Right.
believe you.
Right.
I've seen pharmacists over and over, a patient reports some kind of side effect, and they go, "Oh, that doesn't happen with this medication." Well, yeah,
Mm.
maybe it does. Um, look for healthcare professionals that look for information outside of the drug companies,
Mm.
that think outside the box, and do your own research before taking a medication. And get the opinion of a third party
Hmm.
pharmacy professional that understands the medications.
Yeah. Great
Yeah.
advice. All right, everyone. So, take responsibility for your health.
Amen.
See you next time.
Bye.